Stewie, are you high?
Yeah, so are you. We're on the roof.
Brian's surprising medical skills. What the heck is a lobotomeme? And Peter's code orange? Huh? Get ready to laugh and hopefully learn a little, because today we are breaking down and reacting to all of these shocking medical scenes and ridiculous injuries from Family Guy. Let's dive right in. It's like Mission Impossible. I love it.
Bingo.
Oh no, orange flavored gummies, but there is a marijuana leaf there.
Is that marijuana?
Oh, baby, bonus candy. Not really feeling the sugar rush.
Oh no. Does happen in real life. I've had patients that are children that accidentally have taken too much THC. One event is not going to be dangerous per se. Chronic use of it is very, very bad.
Music will help me relax. Okay, this is good. This is helping. The wheels of a bus go round and round.
Sometimes we see patients take too much of it and do end up in paranoia, psychosis, or because the THC concentration nowadays is so high, we're seeing a cyclic vomiting syndrome called cannabinoid hyperemesis syndrome.
Big no-no. The roof is off limits. Stewie, are you high?
Yeah, so are you. We're on the roof.
You know what the roof is, don't you?
Typically, there's not much to do when somebody overdoses on THC. Usually, it's just supportive measures, make sure they're hydrated, make sure there's no other aspect going on in their body like renal issues or infection, and then time. You need time for it to metabolize out. Oh, Stewie's like gray. You see patients like this, they just don't look themselves because they've taken so much.
Apparently, Stewie was high at school.
What?
It's the worst thing I've seen in my career, and I've seen 4 dead bodies, though technically that was a ziplining accident in Costa Rica. Maybe not the best idea having 13-year-olds securing those carabiners.
Actually, I've been on one of those zip lines in Costa Rica, and I will say they gave me a gardening glove and a piece of leather to help stop myself on it. So I survived, but yes, maybe looking back on it, not the smartest thing to do.
I have a court order to remove him from your custody.
What? No, please.
Where I work at the hospital, we have social workers that work in our emergency department. When these cases do come in, we treat the medical aspects of things, and they can help us from what we're supposed to do from the social aspect, and potentially they will notify the police versus just the child protective services. Is it a straitjacket? We don't use these anymore. Actually, we don't use these anymore at the hospital. I don't know what they do at psychiatric facilities.
What are you doing? Well, I can't get you to stop doing memes, so this exorcism will rid you of them.
Oh my gosh. I don't get memes half the time anyway.
What is that?
You're getting a lobotomeme. When I flip the switch, all memes will rush into your brain.
Oh my gosh, you're getting a lobotomeme. That is really funny.
That's pretty funny.
But a lobotomy is actually done in a much different way. It's not done anymore. Oh no, do not do this. This is not cool, dangerous. In medicine, there is something called ECT, electrical convulsive therapy. It's used for psychosis and depression. People do say that it actually does help them. It's almost like this, but not a car battery.
It's working.
First world problems. Cringe. Weird flex, but okay.
Outside of ECT, what else would we use energy for at the hospital? The defibrillator. When somebody is in an abnormal rhythm in cardiac arrest, sometimes we'll use it for cardioversions.
It's a known fact dogs can smell all kinds of different medical conditions.
Actually, it's interesting. Dogs do have the ability to know if a seizure is going to happen. They are doing studies about it.
Watch. She has diabetes.
Diabetes, if somebody is in DKA, sometimes you can actually smell the acetone that's coming off their breath from the breakdown of their ketones. Unique fruity smell to some people, but you can also have a lot of sugar in your urine. So back in the day, doctors would taste the urine, and if it had a sweet component, they can tell if you had diabetes.
he has migraines.
I don't know how you can smell a migraine,
We've got migraines.
because actually migraines are quite complex, but maybe you can tell that somebody's uncomfortable. Could be hormonal changes, stress, muscle tension, lots of different things. And then there's also vascular components as well.
Oh my God, that's not good. What? I'm getting a whiff of breast cancer from Patty's bra.
Cancers sometimes actually cause VOCs, or volatile organic chemicals, that dogs can actually pick up, thus having the ability to potentially pick up cancers.
First Celine Dion gets stiff person syndrome, and now this?
Stiff person syndrome is super rare, not something I've seen come through the emergency department, but it's basically an autoimmune process that interferes with nerves, causing issues relating to your muscles, misfiring, pain, muscle spasms, just not good. And Celine Dion is somebody that they have diagnosed with it.
Brian, that's my bra.
Oh no. Breast cancer is a real thing. It's unfortunately common. That is why women are suggested to get mammograms. If there's anything concerning, they follow it with an ultrasound and then possible fine needle biopsy.
Siri, what's another word for jugs?
Breasts.
I understand you may have breast cancer.
Oh my gosh. That's the kind of stress that hits differently. Your mind starts racing, your body feels on edge. That's exactly the reason I created Chillax by my company Life Happens, to help support relaxation and take the edge off when your brain won't stop spiraling. Check out Chillax at lifehappens.com or on Amazon.
What's Meg's prognosis? We'll wait for her test results as a formality, but if a dog smelled cancer on her, I'm not optimistic.
So it's super interesting about like Prognosis. All they're doing is citing information of the historical events of people who've come before you, of what the likelihood of, like, say your 50% mortality rate is, how long you have, that sort of thing. But there's so many different factors that come into play. Oh, that is the longest roof ever. Did she overshoot it? Oh, see?
Damn it! Oh, it hurts so much.
Oh, Lois, you're awake. By the way, this lighting makes you look old.
By the cast that's on there, it could be a trimalleolar fracture, it could be a distal tibia fracture or fibula fracture, it could be a fracture within the foot. Definitely wouldn't be related to like a mid-shaft tib fib, because you need to stabilize the joint above and the joint below.
I don't need to know how many guys you've been with. The fact is, I love you more than any number.
The number is 60.
Whoa.
Whoa.
We've got a code orange.
What's that?
It's when a husband finds out his wife has slept with way more guys than he thought.
Oh my gosh. We actually would call this in my hospital code blue.
Code blue. Code blue.
Usually people just pass out, you lay them on the ground, check their pulse, make sure that they're breathing, and then usually over a couple of minutes they will wake up after this. But he fell, so you also worry about head trauma, cervical neck discomfort. Family Guy, it's so entertaining. It's actually very fun to watch. If you guys have more clips that you want me to review and talk about, let me know in the comments. If you have any suggestions on other shows, let me know that as well. And do me a favor, this is episode 33 on this channel of Family Guy. Check out this playlist right here. There's plenty more entertainment and education for you. And do me a favor, make sure you subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.